This is Rashad Woods with the T.R.O.N podcast, and today I have a very special guest, a high-level plastic surgeon based out of Farmington Hills, Michigan, Dr. Michelle Hardaway. Thank you so much for your time.
Okay, you're welcome. I'm glad to be here.
I appreciate it, and I'm so honored that you carved out the time and schedule. And your field of work, plastic surgery, I mean, your training, how did you get into medicine, if I could ask?
It was something I always wanted to do. I always wanted to be a physician. And then in medical school, you rotate through different specialties. And that's how you kind of decide on what specialty you want to go into.
Okay. And so you went to Wayne State University, and then you did your residency over in New York. That is correct?
Right. So I did my undergraduate at the University of Michigan.
Okay.
And then I did medical school at Wayne State University.
That is correct. I'm sorry about that. That is correct.
And then I did general surgery. Then I did a burn fellowship, and then I did plastic surgery. So back when I was training, even though plastics was 3 of general and 3 of general surgery and 3 of plastics, you couldn't get, it was 3 and 2. You couldn't get even an interview unless you had completed general surgery. So I completed a full general surgery residency. Presently, they have toned it down to 3 and 3. So you do 3 of general, 3 of plastics, you can match out of medical school. Before you did a residency, and then you matched into a plastic surgery program.
You know, what I found so interesting was that when I was listening to some of the testimonials from some of your patients, and some of the pictures that I saw, and what fascinated me so much, particularly about plastic surgery, is not just people are working cosmetic, but you reach people in different stages in life, whether they need to get a breast reduction, whether they're looking, cosmetically to feel better about situations. But on the other side to it, and I'm curious about when it comes to plastic surgery, there also could be burn victims, car accidents, and people that had other separate issues. Do you see those people as well?
Well, I did in the past. So with plastic surgery, you can do cosmetic, you can do reconstructive, you can do hand surgery, you can do craniofacial surgery.
Right.
So initially, I did a lot of hand surgery, facial fractures, also burn, because I used to run the burn unit down at Detroit Receiving.
I saw that.
And so, I kind of did almost a full array. Then you can kind of like specialize in certain things. So eventually, like right now, I do primarily cosmetic. When I'm on call at some of the hospitals, usually it's some sort of, laceration or sometimes hand injuries.
Okay. And so when I saw about the consultation, are there some patients that, for example, what criteria do they need to meet to be able to go for cosmetic surgery?
For cosmetic surgery, there's a couple of things. The main thing is you want them to have a realistic expectation. So if a patient, for example, wants to look totally different, like someone else, that may not be realistic. And then there's also some parameters for cosmetic surgery. For example, say someone wanted a tummy tuck and say they wanted to lose 60 or 70 pounds. I would tell them once they get closer to their goal, that's when they want to consider the surgery.
Okay.
And then with any cosmetic surgery, maintenance is required, meaning you want to maintain the results, especially with liposuction, which is one of the top procedures. Tummy tucks is up there in the top 5. There's exercise and diet to maintain the results.
And is that typically, do you see most women either after they've had kids and a couple, at certain ages in particular in life?
For example, a mommy makeover is something that's popular. And that could be a combination. It could be, usually it involves a tummy tuck because that's definitely changed after having kids, and usually the breasts, and which changes after pregnancy. And then you can combine that with other procedures like with liposuction. So the whole gamut is called a mommy makeover, but that could be a combination of procedures.
What's the recovery time for a procedure like that?
Usually patients are off of pain medication in about a week, but there's other things to recover. Sometimes, for example, a tummy tuck, they may be able to go back in 3 weeks, depending on their job. If they do a job that requires a lot of lifting, they may have to go back with restrictions. Breast surgery is different. They can go back, a lot quicker.
One of the questions that I was actually curious about, I saw a lot of women. Are there men that actually are coming in for your services at all?
You see more men now than you did like 10 years ago. Now, in my practice, I see most of the time the men is eyelid surgery. I usually see them to remove bags under the eyes. A medical term is called a blepharoplasty. And then
Okay.
the second would be liposuction.
Okay. Because I'll be honest with you, I'm 42 and,
Hmm.
losing that male weight off the stomach is absolutely the hardest thing in the world. It really, truly is. It is very frustrating when I'm going to eat right, I'm going to work out, and then you look in the mirror and you're like, this is still here. And it,
Yeah, and see, in the men, a lot of times that fat is inside the abdomen, so you have to do it with diet and exercise.
right.
You can't just liposuction it off.
Got it.
So
Got
that's
it.
what makes it a little bit harder for men. But liposuctioning of the back in men is also a common procedure to get rid of those love handles in the back.
It's tough because I had my own little self revelation just briefly about how far what I thought I looked like versus what I actually was. When I was doing
Hmm.
martial arts, somebody videotaped me doing martial arts, and here I was actually seeing what I saw versus how I
Hmm.
really thought I was, and I reacted with horror. It was absolutely the most. I was like, oh my gosh, this is terrible. I thought I looked so much better, until the
Hmm.
video didn't lie.
Yeah, yeah,
So you also were in New York as well too, and you were also an assistant professor at Wayne State University. Are there
right.
more up? So can you give a little brief talk about those experiences?
What I noticed a difference between New York and the Midwest, I think people had cosmetic surgery at an earlier age. For example,
Oh,
rhinoplasties, maybe 15 and 16. Midwest is a little more conservative. That was the main difference. And of course, the prices, may be higher there. I think in Midwest, and it could be all Midwestern states, I don't think people do cosmetic surgery at an early
right,
age. What you do
right.
see is maybe some of the non-cosmetic. I mean, not
Got it.
non-cosmetic, non-surgical things
Okay.
like Botox, fillers. You see that at an earlier age.
Right,
And I think the Midwest, we're a little bit slower in the trends. Like
right,
the East Coast and West Coast, if they're a trend, it starts
right.
there first. Finally, it gets to the Midwest.
Imagine also due to proximity of entertainment capitals and things of that nature, whether you're right when you have television and film out there, and just I'm not. This is just an assumption on my end. Whether it's Broadway, Hollywood, etc., maybe that has a little more appeal to those specific areas.
Yeah, that's true. That's true. And I think cosmetic surgery has become more acceptable over the years.
That's one of the
You know,
questions I was going to ask. Yeah, absolutely.
and so like in the past, people thought you had to have like a lot of money to have cosmetic surgery. Well,
Right,
there are finance companies that just finance
right,
surgery. And so
right.
that's made it more affordable.
Absolutely. And yeah, I'm sorry. I
No,
apologize.
go on.
I was just going to say it's come to the regular individual that I'm not looking to be a movie star, but I would like to fix some things about myself.
Exactly. Exactly. So
Okay.
there's multiple finance companies,
Hmm.
and that's why it's more common and it's actually more acceptable now.
Got it. Do you often have patients who you say, "Hey, you have to lose a little bit of weight, you have to stop smoking, you have to do certain things in that consultation meeting in order to have a successful procedure done?"
Right. There's I'm glad you mentioned smoking. There's certain procedures that you definitely don't want to smoke. One is a
Sure.
tummy tuck, and the other
Okay.
one is something like a facelift. And the reason is nicotine causes small blood vessels to get smaller and
Oh
cut off
wow.
blood supply. Another one is a Brazilian butt lift, which is known as a BBL, where we make the butt larger by injecting fat.
Yeah.
The blood supply is real important. And since
Hmm.
nicotine constricts or makes these small blood vessels smaller, and a facelift or a tummy tuck, you could actually have skin loss where the skin could die in some
Wow.
areas. And a procedure like a BBL or Brazilian butt lift, the fat may not survive because it can't get a blood supply,
Oh
um,
my.
because of the nicotine.
That's
So
wow. That's
those procedures, I would tell the patient they need to stop smoking, or I
mhm.
probably wouldn't do the procedure.
Now, what about people? Because obviously marijuana is more prevalent now. It's socially acceptable. Does that have any hindrance to any procedures people can get done?
As far as we know right now, I'd say no, unless there's some sort of nicotine mixed with it. Now,
Okay.
something may come out in the future, but right now, I'd say no.
Understood. And when you were talking about some of those procedures, I think some of us have seen some of the horror stories that have taken place when people go to these non-qualified individuals and locations to get procedures done. And because it's more prevalent to have these procedures done, how do you combat that? And what do you advise patients who, oh, I'll go to this location out of somebody's house, because I mean, people have died from very, very bad people who are not qualified to do these procedures?
That's hard to combat because usually they find these people by word of mouth. And either they know someone who has gone there or something like that. And, they don't realize that. I don't think they realize the possible complications.
Oh my goodness.
You
Oh my
know,
goodness.
what's popular now also is medical tourism,
Yes.
where people go
Correct.
out of the country. The problem, and they go out of the country because the prices may be cheaper.
Absolutely.
Yeah, but when they come back, it's hard to find a physician that wants to care for them because you didn't do the surgery, and any complication then becomes yours. So that's the problem with going, out of the country.
Absolutely. Absolutely. And then, I'm imagining they have to have follow-ups with you directly, or, about anything that could take place, complication. I'm sure there's, and excuse my ignorance, could be swelling, right? If they're not taking proper medication. There are things that happen after medical procedures. And if somebody went 3,000 miles away, there's that's got to be a very tough conversation to have for somebody.
Right. And when they come back, they often can't find a physician who will take care of them. So sometimes they end up in an emergency room. And if it's something that has to be where the patient has to be admitted, then the plastic surgeon who's on call would take care of them. But a non-emergent problem is really hard trying to find someone to take care of the patient.
Understood. Now, one of the questions I have, this is just, me just with my curiosity of your background. Social media has made people really quickly say, I want to look like that. I want to look like that. I know magazines were in the past, but even magazines were kind of exclusive. Now people all have access to their phones. Do you find people suddenly, I need to look like this singer, actress, have this look for any particular reason? Have you seen an uptick in that? And do you see social media pressure from that?
People will bring pictures in.
Yeah.
And the problem is that's where realistic expectations, like you really can't make them look like that person,
Of course.
or sometimes they'll bring in a picture of someone who, say, has a really small waist, maybe wide hips, but they don't have that same sort of physique. So they have to understand that, you can work with what you have and make it close to it, but you can't make you look like that person. But yeah,
Correct.
social media definitely has done a lot.
For sure. For sure. And do they seem like, I guess this is my ignorance about plastic surgery. Is there an age where like procedures can't get done unless it's medically necessary?
No, well, if it's cosmetic, none of it's medically necessary. Reconstructive is something different,
Okay.
But for cosmetic, because people are healthier, it's not really an age limit. Sometimes you can have a younger person with a lot of medical problems, and they may not be a good candidate, and you can have an older person with minimal problems. So it
Okay.
really depends on their health. Now, the oldest patient that I did, for example, a tummy tuck on was like an 84-year-old lady who
Oh, wow.
ballroom danced, and she
That's
didn't like,
amazing.
yeah, she didn't like the,
Okay.
and
Okay.
she actually did great.
Yeah.
She was healthy. So,
Yeah.
it can vary depending on the health of the patient.
And that's what, I was just curious about that because I was like, how does cosmetic surgery work at certain ages and things like that? What are your most common procedures that people are having, if I could ask that?
I said liposuction and then probably breast augmentation. They're like in the top 5, along with tummy tucks. So
Got
those
it.
are like the top 3 that I see. And the other non-surgical procedures, of course, are Botox,
Yeah.
fillers. People are getting Botox like younger and younger. It's called preventative Botox. So they don't want to get the lines. So
Okay.
yeah. So like, for example, those forehead lines,
Yeah.
lines around the eyes or crow's feet, or the vertical lines between the eyebrows. So that's
Okay.
called preventative Botox. So they may come in, in their 20s if they start to see some lines. And that's the term for it, preventative Botox.
Okay. It's so funny because like you're trying to stave off age, right? And trying to stave off those little things in life. I still check for gray hairs up here, right? And I'm like, well, it's inevitable, right? I've had a couple
Right.
that have popped in, and I almost passed out. Like it was not an easy visualization. So when it comes to plastic surgery, and we talk about the candidates, we talk about the health. Are there any long-term things that people have to be aware of anything when they do their consultation, they have their procedure done? What can happen 2, 5, 10, 15 years from now?
Well, I think the main thing with cosmetic surgery, no matter what part of the body, it's not going to last forever. So, for
Okay.
example,
Okay.
for facial surgery, people will want to know, well, how long will this last?
Right.
Normal aging continues. So there's certain things you want to
Got
do.
it.
For example, use your sunblock, maybe do some facial care.
Right. Right.
For procedures like liposuction and tummy tuck, people really have to maintain diet or exercise. I mean, there
Okay.
are patients where I've done second tummy tucks on
Oh
because,
my goodness.
they either, I don't know, somehow life got busy and they, you know, gained weight and then they came back because they wanted to look like they previously did. So there's maintenance that has to be done.
What about scarring? Like how does the level of scarring on somebody's body, long term end up looking, from
Well,
procedures?
anytime there's surgery, there's a scar. And what we
Mhm.
try and do is minimize the scars. And
Right.
then there are things like silicone sheeting that you wear over a scar to help try and keep it flat. If a scar turns dark, which we call hyperpigmentation, we can use bleaching creams. If a scar is close to the color of the skin, it's not as noticeable.
Okay.
Now, there are patients that will develop scars, which are called keloids, with any little nick or cut. And
Right.
what that is an overproduction of scar tissue.
Right.
And there are things that can be done. We do post-op radiation for those scars. So say if someone
Hmm.
wanted a tummy tuck and they were a keloid former,
Hmm.
we do post-op radiation, and that's about 90 something percent effective in preventing those thick scars.
Is there a busier time of the year that you have when it comes to your procedures that you're doing for people?
It may not be a busier time, but I see certain procedures more.
Okay.
So for
Okay.
example, since spring is coming, I've been doing a lot of breast surgery, a lot
Understood.
of breast augmentation, just, because the weather's getting warm. And
Absolutely.
then I do a lot of tummy tucks, which is called abdominoplasties. Those are all year round.
Right.
But I
Right.
think breast is a uptick probably starting in February in preparation for spring.
Got it. Got it. Yeah, and that's the recovery time from what we said earlier was pretty. I don't say minimal, but that's a little bit. You know, the time someone can recover to be able to go back to normal life isn't as extensive. Is that correct?
Correct. So
Okay.
with most of the breast surgery, probably what requires more as far as recovery are things like abdominoplasties or tummy tucks. The other procedures, there is not much downtime.
Okay. Okay. So, what I found really fascinating is you're in medicine for 30 years, right? And you've always, whether it was burns, when it came to burn victims specifically, just to pivot a little bit,
Hmm.
how does that surgery actually, accident victims? I know that's not your current field right now, but
Hmm.
what level of how does that all take place? Because you always see movies and television shows about people who have burns or accidents.
Probably in real life is probably a little bit worse than what you see on
Oh
television, especially burn victims, because
gosh.
they often have to undergo multiple procedures or skin grafts, and
Right.
it's a lot of discomfort or pain involved in the recovery. And
Right.
then after that, there's some disfiguring of the body. Even when you do skin grafts, that area still looks different from the other skin. So they
Right.
may always be disfigured, with burn victims.
It's terrible. Yeah, and like I said, I just wanted to touch on that because I know that you had done that in previous field, and you also were an assistant clinical professor as well too. What were the
Mhm.
size of the teams that you led, and the upcoming people who had to, that you taught, the teams that you were in charge of? Can you just give a quick rundown of your experience in that was so extensive?
So like on the teams, of course we train plastic surgery residents, and we
Hmm.
often had medical students also. So in
Okay.
plastic surgery, when it was only 2 years, you had a first year and second year. Since it's
Hmm.
3 years now, it could be a first year, second, and third year. And so at some of the hospitals, we would have a resident clinic where
Hmm.
the resident would see the patient, and then the attending would come in, see if we agree with what they
Hmm.
want to do. And then if it's cosmetic, the patients would get like a discount if the resident did the procedure. Now,
Okay.
as far as reconstructive surgery, like at some of the hospitals, what plastics would normally see, lots of hand injuries, whether it's tendon injuries, broken bones in the hand. We also did facial fractures.
Oh wow.
And so there's certain specialties, like we would rotate with ear, nose, and throat, maxillofacial surgery, and plastics, we would be on a rotation as far as seeing facial fractures that would come into the emergency room. As far as hand injuries, we were on a rotation with orthopedics. So you would have an entire team. Now, sometimes there's emergency surgery that has to be done then. For example, say a finger was amputated, or say someone was in an injury and they cut the vessel, say, in their hand or something. Those are surgeries that have to be done then. And it would be a whole team. Microvascular surgery, for example, placing a finger back on, or
Oh my
fingers.
goodness.
Sometimes that could take anywhere from 4 to 6 hours, because we're using a microscope to try and reattach the vessels, and then we're using drills to reattach the bone. So that can be a very long surgery. So you have like a whole team of people. And then in a residency program, the residents may rotate through the various hospitals, say every 3 months.
Okay.
So, they'll rotate, for example, at one hospital where you see mainly trauma, and then they'll rotate to a hospital where they'll see mainly reconstructive. So you have a rotation of residents, coming through.
One last final question. Do you see a lot of athletes that come in, because they get injuries too, as particularly like I do martial arts, people like boxing and MMA. I know it sounds like an off the wall question, but do you ever see like athletes that have multiple scar tissues above eyes or things of that nature? Do you, or, sports injuries, anything like that?
No, I don't see a lot of sports injuries. I may see some like car accidents with scars, but I don't really see that many sports injuries.
Okay, I was just curious.
Professional athletes, yeah.
Got it. Well, did you have any questions for me? I mean, I really appreciate your time. I love the insight, and your field of work is so extensive, and the expertise that you have in it. I'm so grateful that you carved out time to be on the T.R.O.N podcast. But, I got to be honest, medicine is so fascinating, and the work that you do, it's wonderful, the lives you've impacted. And I saw some testimonials, and you have a lot of grateful patients and clients.
Okay, well, thank you. Now, where can we find your podcast? Say if I wanted some of my patients to listen to your podcast.
.com. We're also on all the major streaming platforms as well, too.
Okay.
Apple,
Great.
Spotify, all of the other ones as well, too. And then on YouTube, I have a YouTube channel as well.
Okay. Well, thank you for the interview. It was very nice.
Well, I really appreciate your time, and have a wonderful day. And again, thank you so much.
Okay. Bye-bye.
Bye.